be demonstrating basic instrument passing with or without hand signals. Being knowledgeable of these sets of skills entails less surgical mistakes and to avoid cuts and contamination when handling this type of instruments. There are a few things that we need to keep in mind when we are on the scene. Being knowledgeable of this specific set of skills entails less surgical mistakes and to avoid cuts and contamination when handling these types of instruments. Let's assume that this is a mayo stand and make sure that the mayo stand is on our chest level. And also, the mayo stand should not be above our chest or below our chest because these areas are areas of contamination and there are also possibilities that our mayo stand could be contaminated if it goes above or below our chest. If you are assigned as instructors, it is our role to determine what is the procedure and what are the instruments to be used. Alertness and being focused are the key tools in being one. Nevertheless, we also have to identify the preferences of the surgeon when it comes to instruments and to be able to be familiar with. There are three common hand signals that are used in the OR. First is the scissor, second is the tissue forceps, and third is the stitch. Aside from those three, we also have two main positions that are used by the surgeon when receiving these instruments. One is just like giving a handshake. This is used for instruments such as the scissors, bandage scissors, Alice scissor, and such. And then the second type is wherein it is like putting back a book. This is used for scalpels and tissue forceps. When passing instruments, there are key points that you have to keep in mind. First is the pass firmly. Second is middle finger on the box lock. Third is pass the instruments straight up and down. And fourth, pass it to the position to use. So let's assume now that we are on the OR. So for basic instruments such as the scissors, what you have to do is straight up, middle finger and your thumb is on the box lock and press it firmly. And then surgeon's hand is just like shaking and pass firmly, making sure to trigger the grasp reflex of the surgeon. Again, for example, in a bandage scissor, let's do it again. First, you have to straighten up and then middle finger and your thumb is on the box lock. Make sure to touch it firmly and pass it to your surgeon. Take note that when encountering this type of instruments is that you have to stay away from the tip. For instances, the sharp instruments may cut your gloves and cause contamination. Also remember that curved instruments are passed with the tip curving toward the midline of the surgeon. Another unique tool in the OR is the scalpel. This is one of the sharpest instruments that we encounter as nurses and also as well as the surgeon. Let's assume that this cutter is a scalpel. Since it is a sharp instrument, we have to avoid the tip in order to avoid cuts from our gloves or either our hands, which may lead to contamination. So now when passing a scalpel, what you have to do is grab the top of the scalpel, which is the needle down, and grab the top of the scalpel and then place it on the webbing of the surgeon. Again, let's repeat it. We have to take note that the needle is down, position your hand on the top of the scalpel, and then place it on the webbing of the surgeon. Next instrument is the tissue forceps. Tissue forceps is just like any other basic instruments in the OR, but the difference is that you have to grab the top. Let's assume that this Chinese is a tissue forceps, and just like any other instruments, we have to grab the top, place the forceps on the surgeon's webbing. Now we have finished the scissors and the scalpel and the tissue forceps. Now we move forward to needle holder. Let's assume that this is a needle holder. So in here, make sure that the tip of the needle is pointed toward the midline and at the surgeon's heart. Middle finger and your thumb on the box lock again, handling it firmly, and needle facing toward the midline, making sure that you have to trigger the grasp reflex of each surgeon. To conclude this video, there are key points that you have to keep in mind on this skill. First is again, pass firmly. Second, middle finger on the box lock. Third, pass the instrument straight up and down. And fourth, pass it to the position to use. This is Eugene Marie Costales, your student nurse for today.